As a cancer surgeon, I talk to patients about cancer almost every day. And for something that's so common, I realize that there's a lot of misconceptions about cancer. So, cancer is very common. It is the second leading cause of death in the United States after heart disease. And under the age of 65, it is the number one cause of death, which means that while heart disease is what kills us in our old age, what shortens our lifespan and kills people during their working years is cancer. And in our lifetime, about half of us will be diagnosed with cancer, and 1 in 4 of us will die of cancer. So it is extremely common, um, but it's something that's misunderstood by most people. So, what is cancer? Cancer, very simply, is uncontrolled growth and uh, an invasion and spread of a cell in your body. And so there is a lot of cells in your body. There's the estimates are between 30 and 40 trillion cells. And here's a paper that data comes from. These people out of Italy used various methods to estimate the number of cells in your body. Obviously, no one's gone through one by one and counted all the cells in your body, but their estimate was 37 trillion cells. So any one of these cells can turn into cancer. All of our cells have a different job. Some of them are brain cells and they transmit messages, nerve cells, they transmit messages, muscle cells, bone cells, skin cells. They all have a job and they are controlled by signals that tell them now it's time for you to grow and to replicate, move over here and stay there. And they follow these rules. But a cancer cell decides to just grow nonstop and never stop. And then when a cell grows nonstop, it forms a tumor. A benign tumor just keeps growing in that same spot. A malignant tumor, cancer, grows and actually invades the surrounding tissues. It drills into them and takes over other tissues and also spreads. The other major misconception that people have about cancer is that they think that cancer is one disease because we have a single name for it. But actually, cancer is hundreds of diseases, and each one of them is very different. So if you look at this National Cancer Institute website, this lists all the different types of cancer. And these are very generic names like bladder cancer. This is not the medical scientific name for the cancer, and bone cancer or brain cancer. But cancer can arise from any part of your body and from any cell type. Um, and each cancer type has a very different treatment and has a very different prognosis or your chance of surviving the cancer. And even within the same type of cancer often behaves differently in one patient versus another patient. And then even within one patient, the exact same tumor, different parts of that tumor have different types of cells, and each of the cells in that same tumor can react differently to the treatments that they're given. So, what you can tell is like, here's a website from the NCI again that talks about the different types of cancer and the more common types. And you can see from looking at this list that the most common cancer is breast cancer, followed by lung cancer, followed by prostate cancer. When you look at deaths, the most deaths are from lung cancer, and then next is looks like colon cancer. So what you'll notice is that different cancers have different survival rates. So look at thyroid cancer. There's about 52,000 cases per year and 2,000 deaths. So the vast majority of thyroid cancer patients will survive, whereas pancreatic cancer has 57,000 cases and 47,000 deaths, which means that the vast majority of pancreatic cancer patients do not survive. And so when you or your family member have been diagnosed with cancer, it's important to find out from your doctor exactly what type of cancer is it. And saying like lung cancer is not sufficient because even within lung cancer, there's several types of lung cancers. There's adenocarcinoma, small cell carcinoma, squamous cell carcinoma, mesothelioma. There's lots of different kinds of cancer within the lung. So saying lung cancer or throat cancer does not tell you what type of cancer you're dealing with. So you need to find out the exact name. And then that will help you find out what the treatments are for that and what the prognosis is for that. And so each one will be very, very different. And so that's a very important thing to know, is that cancer is not one disease, but it's many different diseases with many different behavior patterns and many different treatments.